Hello and welcome to this special edition of Community Matters. We've all seen the news, the spread of COVID-19 getting closer and closer, but I'm joined now by Dr. Paul Roumeliotis, and for the next half hour, we're going to be speaking about what you need to know most to protect yourselves and stay informed. Welcome, Dr. Paul.
Good to be here. I'm glad I'm here to answer the questions.
All right, so first of all, coronavirus, COVID-19, we've seen both. Maybe you can give us a little background on this virus and what exactly all that means.
Sure. Coronaviruses are a group of viruses that are the most common causes of the common cold. Probably every one of us has had a human coronavirus, the cold. This particular virus we think came from an animal in China, and ordinarily animal viruses only infect the animals. So if it's a bat virus, they'll infect bat to bat. Very rarely do they go to humans. And if they go to humans, they kind of die in the human, and the human can't transmit it or give it to other people. However, these viruses are smart, and this one mutated to the point where it is a sort of a bat or kind of an animal virus that now has the ability not only to infect humans, but also to be spread between humans, which is new. And because it's a new coronavirus, it's called a novel coronavirus. So the human viruses that you and I have been infected by, if we're infected by them again, our body fights them off because we've seen them before. With a novel virus like this, nobody has seen it. So we're kind of naive. In other words, our body does not have the immune memory. So that's why we worry that these types of viruses will infect many people.
Right, and you mentioned the tie-in with the common cold as well. This is also related to SARS. So talk to me about the difference between some of these past epidemics that we've seen, like SARS.
Sure. Well, the SARS epidemic kind of started the same way. We think from bats as well, but had more severe illness and had a higher mortality rate and was able to be contained. There was 40 deaths in Canada, if you recall, in the Toronto area. So it's a kind of a similar story, but it was contained, and there were maybe 10,000, 8,000 cases worldwide, and about 800 deaths. Good news is that this is not as dangerous as SARS. However, it's more commonly transmitted. And the good news as well is that most people who get it, 85% if not more, will have very mild symptoms, cold, flu-like symptoms, runny nose, body aches, a bit of fever, and it goes away on its own. What we're worried about is about 10 to 15% of the population, namely the elderly and people with underlying medical conditions, lung conditions, chronic heart conditions, all these things that will suffer complications requiring hospitalization. They'll have difficulty breathing, they'll develop pneumonias, and unfortunately some of them will die, which is what we see with the flu as well, right? So in terms of the death rate, we're not sure where we're at with that. Probably 1%, if not less. It's higher in certain other countries. But again, we don't want to go there. So it all has to do with numbers. The more people that get infected, the more people that will be sick, obviously, and then that percentage that require hospitalization and is more vulnerable is bigger in terms of numbers. It's all numbers.
And I think you've hit the nail exactly on the head, but I just want to reiterate on that because I'm still seeing posts on social media of people saying, well, I'm not worried, it's just a cold or it's just like the flu. So what is your message to them?
Well, you know what? In 85% of the people, that's true. However, kids, by the way, get it as well. And kids get it very mildly, which is very good news for us as well. Usually the flu hits kids as well. But in this, we don't have any evidence that it hits kids in a hard way. But kids do get it, have very mild symptoms. And guess what? They're going to go see grandma, grandpa, people that are sick in their family, and they'll give it to them. So it has to do with the 85% trying to protect themselves and not share the virus with the vulnerable population. And that's what, so the good news is that, most of us will do well with this if we get it, but the individuals who are vulnerable need us to protect them because unlike the flu, there is no vaccine for this virus, and there's no specific medication for this. So our only protection is what we call, community-based public health measures, which aim at reducing the number of cases we get, and of course, by that, reducing the number of individuals who are vulnerable who succumb to it, either having hospitalizations or even deaths.
All right, and we're going to be elaborate a lot more on a lot of those topics about stopping the spread, but let's talk about that spread because I think that's something that's very distinctive with this virus as well, is that we've seen it move very far, very fast.
Yeah. Unfortunately, because of airspeed and air travel, the virus can be transmitted throughout the world within a day. And so it takes one individual to bring it to bring it in, and that individual then will spread it to others and others and others. And so we know that the spread of it is really just like any other cold or flu virus, where essentially it's transmitted through droplet secretion. So if I cough or I sneeze, the droplets will go probably 6-7 feet, not more than that, and they will either stick on the surface or somebody else will breathe them in. That's how you get infected, okay? But it's only that close distance. So if you're farther away from an individual, you're good. We also know that with this virus, you need to be symptomatic. In other words, you have symptoms, and at that time you're contagious, which is different from the flu. With the flu, I could be sitting here today, and tomorrow I get the flu, but I'm contagious today. So this is a good thing about this virus, that we kind of know that as soon as you get sick, well, that's when you need to be isolated. That's when you need to be, to be observed for that. So that's the good news. We also know that it takes between 2 and 7 days for the infection to develop. That's called the incubation period, which is really the time between you were first exposed to the virus and the time you develop symptoms. So the average is 2 to 7 days. We say 14 days just to be on the safe side.
All right, and we know that a big reason that this has spread as well has been travel. We're seeing a very high percentage of cases are still related to travel or people in close contact with someone who's traveled.
Actually, virtually all the cases in Canada have been what we call imported. They've been brought in from other countries, which is good, because what we're trying to do, and it shows that our public health system works. So these individuals that came back from China or wherever they came from, Italy, they were told, as soon as you have symptoms, make sure you call the hospital. They go to the hospital, they're all protected, they wear masks and so on. Then they get tested, and we see that they're positive. And what we tell them is, okay, who did you contact? We trace them, we isolate them, and then they're isolated. So we're actually able to put like almost an invisible ring around them to kind of contain it. So that's what's called the containment phase. And we're still in containment phase because we've got probably 100 cases in right now in Ontario. And again, all of them have been transported, have been linked to travel, or somebody who was in contact with somebody has had it, who has traveled. So those are what we call imported. What we're trying to delay and really decrease is what's called community-based transmission. In other words, somebody gets it and there's no history of travel. And then we know that it's embedded, or then it lives in our community. And that's what we're trying to prevent. I don't think we'll be able to prevent it fully, but we're trying to delay it, and we'll try to, and when it comes, we're trying to decrease the effect in terms of how many people it infects.
And the key word there that we're seeing everywhere is flatten the curve, and we will elaborate a little bit more on that term, as well as self-isolation and self-distancing after the break. Welcome back to this Community Matters special edition, focusing on COVID-19 and local reaction and precautions taking place. I'm joined once again, Dr. Paul Roumeliotis from the Eastern Ontario Health Unit. Dr. Paul, before we went to break, we alluded to self-isolation, social distancing, and of course, flattening the curve. So maybe you can explain some of those terms for us.
Sure, let's start with flattening the curve. It's a concept where it's like a bell curve, and so it kind of goes like this, and it's a steep curve. So what it is, it's how many new cases we see a day. So over a period of time, it goes up, and then it goes down, and it's a bell curve, right? So what we want to avoid is we want to avoid how high that number gets per day, and how long it takes. In other words, we don't want to have thousands of cases in a couple of days. We want to have maybe 10 or 20 or 30, spread over a period of time. Why we want to do that is because, again, it's the numbers, and also if many people get sick at the same time, it'll overwhelm our healthcare services as well. So when we talk about flattening the curve, we're saying, okay, we don't want to get X thousands of people a day. We want to get as low as possible and spread it out over time. Then it gives us time to be able to be more prepared, and then also less people get sick. So that's what flattening the curve means.
And we're seeing the risks associated with not flattening the curve. We're seeing it in Spain and Italy, and that did not have the precautions that we currently have.
Exactly. Unfortunately, in those countries, they did not do things in time, I think, to be able to flatten the curve. And I think that we're ahead of the game here because we're still containing it. But, you can go very much into community-based, and that's what we want to prevent. And we can't, like I said, we can't prevent it from coming into the community, but we can sort of decrease that curve, flatten it as much as we can, spread it out over a period of time, and hope that and work together to decrease the number of total people getting infected.
All right, and locally here, we know that things change rapidly depending on when people are watching this, but it has made an appearance already.
Sure.
So what is your advice to people to stay safe?
Well, first of all, I wanna reassure people that, like the first case we had here, I wasn't surprised because a lot of people travel, and so this individual came from New York and developed symptoms, and we tested, and it was positive. Again, we contained it. I think what people should know that individual does not pose a risk to the public at this point in time, did not pose a risk at the school she was going to, and so on. But I think in general, what we need to, it just shows us that it's close. It's close by, and we need to take the proper precautions. And so, as I said, there's no vaccine available, there's no medications available for this, and our only recourse is what we call public health measures that really start from the home and then start in the community. From home, essentially what we tell people, obviously if you're sick, you stay home, but then to prevent infection, it's a personal thing. Wash your hands frequently, disinfect surfaces frequently, because we understand how the virus is transmitted. Stay away from people, a couple of meters distance if you're going outside. Sneeze or cough into your sleeve. Those type of things, those are what we call those public health measures, hygiene measures, sneezing or coughing etiquette. That's what we're talking about. Then you're talking about more outside of the community, where you're talking about social distancing. Social distancing, what that means is that you distance yourself from a lot of other people. That's what it means. So it can range from just staying home, avoiding large gatherings, or banning large gatherings, closing schools. All of the things that are being done, which are, we tell people to stay home, particularly if they're vulnerable. I would stay home. I would say don't travel unnecessarily, and that's very important. At this point in time, we don't recommend travel outside of Canada. That's very important to know. And essentially, in terms of the other precautions that we're taking, they're more community-based. We're working with the workplaces. We're saying to the workplaces, well, if you've got a lot of people working together, think about maybe spacing them out. Make sure you have hand sanitizer, hand washing stations there available. Stagger your shifts, those type of things. And at the same time, maybe you could think about working at home. Those type of things. And as we get more infections, we're going to ramp that up as well. Already we're talking about gatherings, mass gatherings. We're requesting that people do not have gatherings more than 250 people. But that also depends on the risk. If you're going to get 200 people together, they're all elderly, I wouldn't put them together. You got to be logical about it. So those are the type of things that we're doing, all the way to, like I said, closing schools, closing universities, even asking restaurants to at some point only serve to go or delivery, which close down bars like Quebec is doing. Some of the provinces are doing it, and those are measures that we take depending on the situation. And they could be as simple as just staying at home. Don't go out unnecessarily. Maybe be logical about it. If you want to go to the mall or shopping, do it off hours. Make sure you're distancing yourself and those type of things. And obviously, when you're sick, stay home. And that's the most important thing, because like I said, in order for you to be contagious, to spread it, you have to be sick. So that's why it's an important thing that we need to do collectively. And it ranges all the way to what we can do is quarantine a whole city, quarantine a whole country. Like they did in Italy, like they did in China. They quarantined 59 million people. We're not there at that point, and we're not there yet, but those are the type of things that we need to do. So essentially, we're actually relying on everybody to collectively do their thing, not because I want to protect an individual only from, okay, he's going to get a cold, it's going to go away, but we want to protect the vulnerable. And that's the main thing that we do: protect the vulnerable and ensure that we don't overload our healthcare system.
All right, and you use the term overload, and for the healthcare system, we know our grocery stores have been overloaded. So let's talk about some of the stocking up and the panic buying that's been going on.
Sure.
Of course, it's good to have a reserve of things, but not to the degree that we've been seeing. So what's your advice to people?
I think that it's been overplayed. I think some people call it stockpiling, which I don't like that word. It's not like we're going to have a big tornado and we're going to lose power and we're going to lose water. It's not like that. These things come slowly, like a dimmer. It kind of dims in. And so I think it's logical if you're going to stay home a couple of weeks or a week or two, make sure you have enough supplies, medication, food, and so on, and know how to get things delivered if you're self-isolated. I don't think you need to buy 20 rolls of toilet paper. I don't understand why people are buying toilet paper. I can see why people are buying hand sanitizer and Kleenexes and disinfectants and so on, but I don't understand the toilet paper. And I don't think people are hoarding because they're very worried. We've been reassured by our government that we have plenty of food supply in the chain, and there's no issue. I think people should just make sure they have enough for a week or two, if they're isolated or if they're sick at home, and then take it from there, like a cold. Like I said, the majority of the people will have a mild cold.
All right, and just before we hit break, you did mention medications as well, and I just want to elaborate on that quickly. Is that the importance of having all the proper medications at home in case?
So when I talk about what you need at home, it's food supplies, and then infection control supplies, hand washing and soaps and all. And by the way, if you don't have hand sanitizer, soap and water are great. Don't worry about it. And then obviously medications that you would need, like over-the-counter medications to help if you have fever or anything. And importantly, that if you are taking prescription medications, make sure you have enough.
All right, so after the break, we'll talk a little bit more about the future, what we're looking at in terms of maybe crystal ball of what maybe we're going to look at here locally, as well as what to do if someone suspects that they may have a case. We'll be back after the break. You're watching Community Matters Special Edition. Welcome back to Community Matters Special Edition. I'm joined by Dr. Paul Roumeliotis. We're talking about COVID-19 and its local effects. And Doctor, I think a lot of people are wondering as they're hearing about all this social distancing and isolation, what are we looking at for a time frame here?
That's a good question. I don't have the answer. I know that we're looking at probably the next couple of weeks. We're not talking months, we're talking weeks, I think. And that's why we're starting to rev up what we call our containment. I still think all what we're doing right now in terms of the social distancing and canceling of schools and all that is part of our containment process to ensure that it doesn't go rampant into the community. But once we start seeing community infection person to person, I'm not sure what the timelines are. But we're keeping a close eye on it. We're surveying. We're looking at. We're testing. People are getting tested, and we have evidence of infections and so on. So we're monitoring it. Part of what we do in public health is we keep up with the labs. What lab results are coming. We know what the trends are. We know how many people are sick. We follow schools. Like now schools are out. But in general, what we do, for example, for the flu, we know if the flu starts in schools, it's a gauge. So we're gauging now what it is, and so far, like I said, we have not had any cases that are what I call homegrown. The one that we've had is just imported, like the others in the rest of Canada. But the timelines are difficult to say. But I'm not going to say months. I'm going to say weeks.
Okay. And of course, one of the things you hear a lot, whether in talking with people or on social media, is a lot of people wondering, is the warm weather going to help? Sure. But also some fear is this going to come back in the future?
That's a very good question. Because it's a new type of virus and it's not necessarily like the flu. We know that with the flu, when we had H1N1, we had two phases. We had one in June, and then we had a second phase in the fall. Now, we're not sure what it's going to happen. A lot of people are saying it's going to come, it's going to cause a lot of infections, and then it'll stick around like the regular cold viruses. We're not sure. So we're keeping an eye on that. We have to see, again, part of our surveillance and part of our monitoring, and we'll be testing people, so we'll be able to know, if you're sick, let's say somebody's sick in September, we'll be able to see and then gauge by the numbers and the density of those infections to see if there's a second phase that's going to come or it just fizzles out. We're hoping it'll just fizzle out.
Absolutely. So if someone does come down with symptoms, obviously the first advice is to stay at home, avoid contact. But when should people seek medical help?
Okay. First of all, the other thing that complicates our lives is that we're still currently in cold and flu season. There's a lot of viruses, a lot of going around. We still have flu outbreaks in our area. And so just because you have a cold or a runny nose does not mean you have COVID. As a matter of fact, you probably don't have COVID unless you've traveled. And that's the kicker. So at this point in time, because we don't have any transmission in the community, our criteria for testing an individual is that if an individual comes from another country to Canada and within 14 days of arriving here develops those symptoms, then we'll test that individual. I can tell you we've done that in our area to about 58, 60 people, and only one has come back positive, and thousands have been done across Ontario, and we've had many thousands, and we've had only a few cases, but we're still testing, you see. So I think that when you're looking at, you're worrying about it, unless you've traveled, you don't have to worry about it. However, once we start getting more and more into it and know that, well, it's rampant, it's everywhere. At that point, we're going to tell people, stay home, wait it out, don't go to see grandma, that type of thing. And so I think that'll switch. We're not there yet. At this point, what we're saying is we're going to. The other thing too is if you have no symptoms, we're not going to test you. Very simple.
All right. Now, there has been word as well, though, of testing centers. And we know some other cities have established them, and I know it's on your radar as well.
Yes. The testing centers and the assessment centers are part and parcel of what we call our pandemic plan. And they're meant to be created not on hospital sites, in order to help decongest the hospitals, because we don't want thousands of people running to the emergency room just to get tested or because they're worried they have COVID. And so what we've done, it's the Ontario Health East, which is the former LHIN, has now created kind of a cluster areas, starting in Scarborough, starting in Oshawa, Kingston, Ottawa, and they're starting assessment centers because they have more people, more population. We're preparing to create assessment centers here, and we just can't do one because our territory is 5,500 square kilometers. So we're looking at about 5 or 6 in our area, should we need them, okay? And what the purpose is going to be, initially, if we need it, let's say we get overwhelmed and need a lot of people to be tested, those will be, you go there, you get tested, instead of going to the emergency room. The second phase of that would be what we call just an assessment center per se, where if you're worried about you having a COVID or symptoms of COVID, we don't want you to go to the emergency room. This is to redirect you to those assessment centers where you go and get evaluated and you go home. Obviously, there's all kinds of mechanisms you can call telehealth. Now there's a new web on ontario.ca/coronavirus. There's actually a self-assessment tool that tells you what your symptoms are, likely don't have it. And if you do, let's say we do set up a assessment center, you say, I live in Cornwall, it'll tell you where to go. Right? It'll tell you, don't go to the emergency room or see your doctor or go to these assessment centers. Because like I said, one of our goals is to try to decongest the emergency room so they can take care of the sick individuals who, the elderly and people with chronic medical conditions. Now, when do we trigger these? We're getting them ready. We're as we speak, as a matter of fact, today we're locating a place in Cornwall and 4 others in our area. And they will be just ready to go based on the emergency room surge, the emergency capacity, and the presence of the infection. We do that, I hate to say play by ear, but we'll see what the situation requires. So we may start in Cornwall sooner than we would in Castleman, or vice versa, depending on the situation. But we're working with our 4 hospitals in our area, our primary care physicians, our nurses, nurse practitioners, even our paramedics to be able to staff them as well. We don't want to take away staff from the hospital. We want these to be staffed by non-hospital personnel, because the hospital personnel will be needed in the hospital setting. So the goal really is to give a place to people to go if they're worried. But at this point in time, we don't have any because we don't see the need yet. But we're keeping an eye on it, and we're ready to go should the need arise.
And just finally, information is power. And, YourTV, we're doing our best to educate viewers. But if people want to find out more information, if they have concerns, where is the best place for them to look?
Well, there's a couple. Our website, eohu.ca, has a very good page on coronavirus. Frequently asked questions. As a matter of fact, I will be putting a video on where I give a talk about coronavirus on it with some slides to show people what it is. That's one of them. The other one is ontario.ca/coronavirus as well. That's the Ontario website where you can get all kinds of information, and you can also get that self-assessment tool that I talked about that was just released literally a couple of days ago. those are kind of the best ways to do it. There's also the telehealth line that you can call and answer questions. We get a lot of calls at the health unit, but at the health unit we don't treat people, so we get a lot of questions about should I test, should I not test, and so on. And I just want to make it clear that if you've come from out of the country and you develop symptoms, then we will direct you to be tested at a hospital or wherever. At this point, we haven't overwhelmed. Like I said, we've only done 58 or 60 tests since all this started. But as we see it ramp up, we'll be able to direct you to another place. So for the time being, you're right. Information is I call it comfort. Knowledge is comfort. That's kind of my phrase. And the more you know about it, the more you understand it. And I don't want to panic. I want to prepare.
Excellent. And on that note, I'll thank you once again, Dr. Paul, for joining me for this special to educate our viewers and get the knowledge out there and hopefully provide some comfort and some preparedness.